Today News Update.
It's Monday, August 22, and this is your Barbados Today Evening News Update. So glad you could join us. Public service vehicle operators could soon be paying less for fuel under an arrangement with a major player in the industry. Chairman of the Alliance Owners of Public Transport, Roy Raphael, has revealed to Barbados Today that the association is working with Rubis on a deal that would provide them with much-needed savings.
We have to return to the table again on Friday because we will have a number of options was put on the table on our side, as well as a number of options were put on the table on their side. And they have access to go away and look at it, put it to our members. They will have explored some of the areas in which they would have worked with some of our counterparts in the Caribbean, such as Grenada, the Grenada Transportation Association, the Minibus Association of Grenada. They would have worked with them. They would have worked with Cayman Island and a number of other companies. So I would say, yes, discussion is still going on. We're hoping that by next week we should be in a better position to speak to the public about it.
The island's chief medical officer is concerned about high COVID-19 deaths among the elderly. Dr. Kenneth George says even as the island continues to ease restrictions and resume a range of activities, citizens must be more mindful of how their actions can impact this vulnerable group.
85% of deaths are occurring in people 70 years and older. It's occurring too often. So while we relax on one hand, I'm again appealing to the public that particularly when you have older persons in a household, that you pay specific attention to them. Because frequently these older people have comorbid conditions like diabetes and hypertension. And once COVID and diabetes, hypertension, kidney disease, etc. mix, the outcomes are frequently not good.
He was speaking on the sidelines of a conference hosted by the Pan American Health Organization, examining events resulting from vaccination or immunization. Dr. George revealed that the island will soon have new directives, which will see a further ease in restrictions, but he notes that mask wearing will remain in place.
There are some new directives that will be coming out on the 29th, and that will again reflect a further reduction in the, because we don't want to be in a place where we know too much about the virus for us to be in a state of emergency. What I will tell you is that mask wearing will continue for some time to be pivotal to prevent spread of infection. And because we require people to wear masks, particularly when they are indoors, it is important that the directive continue for a little longer.
Co-coordinator of the National Vaccination Program, Dr. Elizabeth Ferdinand, is equally concerned about deaths among the elderly, and she is again urging more people, especially the young, to get vaccinated to help protect their elderly family members.
I need more people to come forward and get their boosters. And then there's still that little 30% who have not come forward. And these are people between the ages of 20 and 50. You young people, and I'm calling you young, I wish I was that young now, but we need to get you vaccinated because you're the ones who are taking the disease into the homes and giving your older parents and grandparents. And as CMO has just said, they're the ones who are dying, the elderly with comorbidities. So yes, I want you to come up and get your boosters. And if you haven't had a booster, and haven't had any vaccinations, come and get them. I've got a special AstraZeneca in. It's only valid or eligible till the end of August. So please, if you want Astra, come now and get it before the end of August.
A clear case of poor economic and financial management by the former Democratic Labour Party administration. That's how Government MP Marcia Caddo described some of the irregularities revealed in the Ministry of Finance's response to irregularities in the Auditor General's report. Speaking at the annual general meeting of the League of Young Socialists at the weekend, Caddo said the 64-page report made clear that the DLP left behind a range of problems the government now has to face and fix.
It tells us, for example, that we had an audit of a school meal center under the former Democratic Labour Party administration that was proposed to provide meals to 20 schools and was supposed to cater to emergency situations in the event of a national disaster. That was to have been constructed between August 2012 and January 2014 by a firm that was undisclosed. We don't know who got the contract. For $19.9 million. By 2016, construction had been halted. And a Barbados Labour Party government then decided that it was important to continue work on the center. But let us get it clear. The Auditor General's report in many ways points out poor economic and financial management of resources from a previous administration that we decided to face and fix. Now, similarly, with respect to the whole issue of Clearwater Bay and the Four Seasons project, and I'm not going to spend a lot of time talking about this, but the fact that these actions, a series of actions taken between 2011 and 2016, where an advance given to settle a loan guarantee made in respect of the project was not properly appropriated, causing the asset or its value to be written off, which is the only accounting opportunity that you really have. Those actions were taken between 2011 and 2016 under a previous Democratic Labour Party administration.
Members of the Democratic Labour Party are upbeat as they emerge from the party's 67th annual general meeting this weekend. Supporters told Barbados Today they're fully behind President Dr. Ronnie Yearwood. They say there's a new buzz in the party and big things are ahead.
I see a different vibe. I feel a different vibe. I understand that there's a need for change in Barbados and the new politics that Dr. Ronnie Yearwood is professing to bring to Barbados. I am fully confident that he is going to be able to bring what Barbados needs going forward.
I look forward to working with Dr. Ronnie Yearwood and doing a lot of projects with the youth. And I want to encourage young people to go ahead and, you know, be open-minded about this party and also to look towards the future of something new, something more, you know, innovative and bright.
We saw a revitalization, a reinvigoration of leadership, you know, with Dr. Yearwood as well as Senator Clement, and just to see a little bit about the inner workings of the party as well. So for me as a first-timer, that was supercharging. It was awesome, and I'm happy to be a part of the Democratic Labour Party at this point in time.
Regional and international news coming up after this short break.
Pure oxygen is way more than just water. We infuse pristine water with over 1 billion tiny oxygen bubbles using our state-of-the-art process. The benefits of additional oxygen are huge, from strengthening your immune system to increasing energy levels, stamina, and sports performance. And that's not all. It also improves skin health, helps you sleep better, and reduces stress. Join the movement of people experiencing the benefits of pure oxygen. It's not hype, it's science.
Welcome back to regional news. Trinidad and Tobago's public sector unions today doubled down on calls for the chief personnel officer to increase the government's wage offer to 4%.
Leaders from the Public Services Association, the Fire Service Association, and the Prison Officers Association are demanding a better offer from the Chief Personnel Officer. Collectively, the respective leaders, Leroy Batiste, Leroy Ramkisoon, and Saron Richards, say their memberships will not accept the offer and they are prepared to take a stand.
Asking, pleading to the CPO and all its principals to treat with that matter as a matter of urgent public importance, and in the absence of which we will say that the government is embarking on a journey to shut down Trinidad and Tobago.
Mr. Richards describes the 4% offer as a pay cut, since it does not address the 22% increase in inflation. Meanwhile, Mr. Batiste says the expectation that these workers in essential sectors would continue to work no matter what they are paid is wrong. He insists they will need to feed their families and meet their responsibilities.
This will end. This will end with workers being able to maintain their standard of living. That's correct. It's the only how it can end.
On the international front, the U.S. has reported more than 14,000 confirmed monkeypox infections, a weekly increase of 30%. White House officials are trying to secure an additional 2 million doses of the vaccine to prevent the disease.
Vaccination clinics like these are now popping up across the country, but critics say the Biden administration was very slow. At one point, leaving hundreds of thousands of doses of the vaccine that the U.S. already owns in Europe. So now officials are trying to stretch the vaccine. By administering it in a different way, they're hoping to get 5 doses out of 1 vial. But there could be a problem with that.
It's totally unclear that anything I've read on the science, if the degree of protection is identical to what the original proposal is, or prescription, which is to get 2 full doses.
Bob Goldstraw says he was turned away from getting his second shot. He believes it's a problem of supply. The D.C. Health Department blames the Biden administration.
What we end up getting is 12,000 doses. Had we got 12,000 vials of vaccine, that would have been some 60,000 doses that we would have had.
The monkeypox virus has spread quickly in the United States. The first case was reported in May. The CDC says there are now more than 14,000 confirmed cases. The Biden administration says they are working to secure millions more vaccine doses, but health experts say that creates other issues.
We really need to be partnering with our global partners and colleagues around the world to make sure that vaccines aren't just made available to high-income countries like the U.S. and Europe, but also that, it's pretty alarming and disgusting that now there are still no vaccines made available on the continent of Africa.
The maker of the vaccine says it will take months to expand its production capabilities, but experts say the window to contain a broader outbreak could already be closing.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper email updates or like us on Facebook. Sign up for our breaking news alerts via WhatsApp. We're also on our Zoom Medium bus terminals as well as screenplay at supermarkets and gas stations near you. You can also hear us on Capital Media HD 99.3 FM.